just a quick review of the book, Knee Meniscus, Knee Cartilage Injury and Surgical Options. Subtitle, Understanding What Your Surgeon is Talking About. And that's probably the best explanation of the book. It gives you a lot of information so you understand if you go to a surgeon, what he is talking about, so then you'll know. So that's kind of the thrust of the book. Basically, it's divided up into 24 chapters. I won't go over each one, but I'll list a few of them that I thought were interesting. The knee meniscus, kind of like the anatomy, what it does. Goes into tears in relation to blood supply, talks about complex tears, ligament avulsions, meniscus degeneration and extrusion, clinical signs, early rehab, repairing a tear, consequences of meniscus destruction, knee replacements, meniscal transplantations, how to repair an avulsion. So you can see it gets a lot of kind of some technical kind of stuff. But that's kind of the point, so that if you go to the surgeon, he starts telling you this stuff, hey, you know what you're dealing with. So yeah, as you can see, it covers a lot of information. My major takeaway is that this is a great resource if you want to learn all about the meniscus and some of the surgeries for surgical treatment. So if you have a meniscus problem, you want to know a little bit about maybe some of the surgical aspects that can help it, I think this is a good resource. However, if you have torn your meniscus and are wondering like what to do about it, or you want more of a do-it-yourself book, there is one I know of. It's called I Tore My Knee Meniscus, Now What? Written by Jim Johnson, PT, a physical therapist. Basically, this is a do-it-yourself book. This will guide you like what to do, as opposed to getting like a lot of information about surgeries. This will say, hey, where do you go from there? Do I need surgery? First part's just, anatomy kind of stuff, so you kind of know what you're dealing with. Then it goes into the different types of tears, because a tear is not a tear, is not a tear. Some tears will heal on their own. That's related to blood supply, and others won't. What to do, the options. This is probably the best part of the book, I think, besides the exercise program. Goes over, this is evidence-based. Like, they'll look at all the studies, like if a person had a knee meniscus problem and they took the whole thing out, they followed them for like 20 years. What happened to them? What if you just take part of it out? What happens to your knee? Do you do okay? What about if you repair it? What about if you leave it alone and do nothing? Exercise versus surgery, which one's better? To figure out which one's better, you're going to have to look at randomized controlled trials. This book has compiled all of them that compare surgery to exercise, and come to find out exercise does just as well as surgery. So whether you have one or the other, you end up at the same place. If you have a root tear, that's a different type of meniscus tear. You need to know about that. So anyway, so that way you come out with a lot of education about like, hey, what to do, and if I do this, what will happen to my knee over time? Some things a surgeon may not tell you. A few tips to make things go easier. If you need a cane, it'll help take a lot of weight off your knee so you can walk better if you're to that point. It'll tell you how to do stairs, best way to get out of a chair, icing your knee. This is just the best do-it-yourself book if you have a knee meniscus problem. And then they have the whole program. Whole program probably going to take you less than 10 minutes a day, but it's all based on research. And they also have programs for beginning, intermediate, and advanced. So wherever you're at, some people have a tear, it just kind of nags at them a little while. They can do more advanced exercises. Other people have like an acute tear, they just tore it and they can hardly do anything. So it's basically for any level of a meniscus problem. So do-it-yourself book, this is a good one here. If you're looking for a lot of information about surgical options, so that when you go to the doctor or surgeon, you know what's going on, I think this is a good resource. So check it out.